living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
More than 100 million Americans are affected by chronic pain. In the past, opioids have been the go-to treatment. But with high rates of opioid complications and deaths, patients and providers are looking at new ways to manage pain. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we're going to take a look at alternatives to opioids. Stay with us. Welcome back to Healthy Living for Life. This morning we are talking with Dr. Douglas Kunzweiler, who is the Chief Medical Officer at Mountain Pacific Quality Health. Thanks so much for being with us this morning, Dr. Kunzweiler.
Thanks for having me.
So let's start out first. We're talking about chronic pain, and we've talked about chronic conditions and chronic diseases before, but I just want to make sure that we understand what we mean by the word chronic. Can you start out by defining that for us?
Well, for pain, chronic pain is usually defined as pain that lasts longer than 3 months or 12 weeks. We expect to have pain after an injury or a surgery, but we also expect that it will pretty much have resolved after 6 to 12 weeks. So if it lasts longer than that, by definition, that's chronic pain.
Okay, and I think what you're talking about there is a term that some folks might hear, acute pain. So can you talk then about what's the difference between if a doctor talks to you about acute pain versus chronic pain?
Yeah, acute pain is the pain that starts right after an injury or, let's say, a surgery, some damage to tissue. And that's normal. Our bodies are supposed to experience that, and that alerts us to let that part of our body rest and heal before we start using it too much. Chronic pain, though, we think when things don't heal quite normally, then there are changes that happen in the brain and in the nervous system that keep that pain going. And there are actually changes in brain chemistry and in the neuroreceptors, the parts that register pain in our brain, and they sort of enlarge the pathway for pain to flow, and it becomes an ongoing situation.
So how can providers tell when something like that has happened and somebody is now suffering from chronic pain? Are there tests?
There aren't really tests. It comes mostly from the patient's experience, their history. You would expect after an injury or an operation that things would gradually improve, that the pain levels would gradually improve over the course of the next 6 to 12 weeks. When that doesn't happen, when the pain level doesn't gradually improve, but stays the same or perhaps even worsens, and more importantly, when the patient's function does not improve back to the pre-injury level, then that's a chronic situation.
And how can you tell what a patient's pain level is?
Well, unfortunately, we don't have a good objective measure of that. So there is a pain scale, which you will find commonly, and that's on a scale of 1 to 10. The patient is asked, on a scale of 1 to 10, how is your pain right now, with 10 being the worst pain you could imagine. And as you can see, that's fairly subjective. Mm-hmm. Another way to measure it, though, is to talk to the patient about how is the pain that you're experiencing affecting your life? How does it, interfere with your normal function, with your ability to do your work? How does it interfere with your ability to enjoy your life? How does it affect your sleep? How does it affect your motion? So talking about how the patient is functioning, I think, is a better way to estimate the pain.
Okay. And is chronic pain something that people tend to develop as they get older?
Not necessarily. Young people who experience an injury can also suffer from chronic pain. I think it's true that as we age, we have degenerative joint disease, and so we have the tendency to have more stiffness and more chronic pain, but young people can suffer from it as well.
We talk a lot on the show about how to prevent chronic conditions. Is it possible to prevent chronic pain?
One thing that we have learned is that the sooner you begin to treat pain and the sooner you begin to mobilize a patient, get them moving, the less chance there is of that pain becoming chronic. So we are getting better and better at preventing the onset of chronic pain. We're not as good as we want to be, but we're learning things as we go. And really the key is to return to function as soon as possible.
Can you talk a little bit about whether or not chronic pain can be expensive for a patient? Are there costs and other burdens associated with chronic pain?
Oh, yes. When you look at treatments for chronic pain, hospitalizations, medications, visits to the doctor, the dollar figure for that runs up into the billions. And then when you add in the productivity that's lost because people aren't able to return to their usual jobs, and when you factor in the loss of enjoyment of life and usual activities, why the cost is very, very high.
I've read that chronic pain can sometimes be managed by a good night's sleep. Is that true? Is pain and sleep somehow connected?
Yeah, actually, sleep is connected to everything. If you're not sleeping well, everything is worse. So part of treating chronic pain is good sleep hygiene. That is, the better you sleep, the more rested you are, the better you will be able to tolerate your pain and deal with it and manage it. So sleep is important.
Can you talk about when someone should talk to a doctor if they think they're experiencing chronic pain?
And again, that's sort of a subjective thing. Some advice I would say is if you are worried or concerned about your pain, then that's a good time to talk to your doctor. If your pain is interfering with your normal enjoyment of life or your normal functioning, then that's a good time. And in general, I would say the sooner you talk to your primary caregiver, the better.
Okay, perfect. We actually need to pause here for just a quick break, Dr. Kunzweiler, but stay with us. Coming up next, we are going to talk about how people can manage their chronic pain without turning to opioids. We'll look at some of those alternatives right after this. Don't go away. We'll be right back.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
It was a beautiful day. There was about 2 square feet of ice near the door, which I slid on and fell, cracking one rib. And I became somewhat frightening for me to walk outside, particularly in the winter. The Stepping On program came as kind of a surprise to me. I didn't know about it. I've learned the importance of proper balance. I think anybody who has fallen or is afraid of falling would benefit from this program.
"45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything."
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Welcome back. Dr. Douglas Kunzweiler is still talking with us, and now we are going to start talking specifically about opioids, some of the risks, and how people can avoid those with dealing with chronic pain. So thanks for staying with us, Dr. Kunzweiler. So first, generally speaking, would you say that alternatives to opioids are effective when it comes to dealing with chronic pain?
Yes, and one of the things that has become quite obvious is that opioids are very good medicines for acute pain. If you have an acute injury, you break a bone, or you have a surgery, the opioids are superb at taking that pain away. But once pain becomes chronic, opioids really don't work very well. The body develops a tolerance to the medicine, and that means that its pain relieving effect no longer works as well. And the longer you're on the opioids, the less well they work. And so we know now that opioids are really not a very good solution for chronic pain. And we've developed a number of other medications, other treatments that are more effective than the opioids for treating chronic pain.
Okay, great. So let's start out by talking about some of those other medications. What are they, and how does someone get them? Is it still through prescription? Can you just talk about that a little bit?
Sure. There are a lot of them. One of the big categories are the anti-inflammatories. And these are the medicines like ibuprofen and naproxen, aspirin. Another category is acetaminophen or Tylenol, which is good medicine because it has very few side effects. And then there are a whole series of other medicines that actually were developed for other problems, but have been found to be helpful with chronic pain. Some of the medicines that are used for depression, the newer ones that are used for depression, have been found to be quite useful in chronic pain. And some of the older antidepressants, especially some in the category of tricyclics, one of them is amitriptyline, which is a commonly used antidepressant, has been quite helpful in pain. There are a number of medicines that were designed to treat seizures that have been found to be quite useful, especially in pain where a nerve is being compressed or irritated. These are medicines like gabapentin and Lyrica. So those are medicines that have been found to be very useful. The steroids, which are medicines that have a very profound anti-inflammatory effect, are useful, although you have to be careful because they can have significant side effects if they're used for long term. But injections of steroid medicine become a mainstay of treatment of many chronic pain syndromes. There are a lot of good topical medications. Some are numbing medicines, like the dentist uses when you have a tooth numbed up to be worked on. These can be applied to the skin surface, and they work quite well. There are anti-inflammatory topical medicines as well that are very useful. And there are new discoveries all the time. Cannabinoids are being used in chronic pain now, and there's some pretty good results from that. So there are lots of different options of other medications that are not opioids and don't have the problems that opioids carry.
Yeah, it sounds like it. So let's talk about some of the other options that are not medications. Can you talk about how exercise can help with chronic pain?
Yes, exercise is critical. Our bodies were made to move, and when we stop moving, our joints stiffen up, and that actually makes the chronic pain worse. When we exercise, chemicals are released in our brain called endorphins, and those are the chemicals that the opioids actually stimulate. So when you exercise, you get some natural opiate sort of activity. But in addition to that, exercise strengthens our muscles, and that helps to stabilize our joints. And if you're having troubles with joint pain, increasing the strength around those joints helps, relieves the pain, and actually increases function. Movement lubricates your joints, and that makes everything less painful as well. So exercise is critical to return of function, and we also know that it helps to actually reduce the pain level.
Are there any risks that people who are in pain should take into consideration when trying exercise?
Well, if you have other chronic underlying diseases, heart disease or high blood pressure or diabetes or kidney troubles, then you should talk to your primary caregiver, before undergoing an exercise program. Okay. But in general, as long as you use common sense and, you go at things gradually, there's really very little downside or side effects to exercise.
Okay. Another possible option is cognitive behavioral therapy. What is that?
Well, cognitive behavioral therapy is a form of counseling, and what it involves is reframing your thought patterns to help you increase your abilities and function. even if you can't completely remove the pain, you can alter the way you react to that pain. And counselors who are trained in that can help you work through that. And it's a way to take control of your life and not let the pain limit your function.
Okay, we just have under a minute left here. Dr. Kunzweiler, do you have any closing thoughts on folks who are looking for alternatives to manage chronic pain?
Well, I would say, first of all, don't lose hope. Pain can be managed. It can't always be removed completely, but with guidance and help from your primary care provider and all of the adjunctive things we talked about, it can be managed, and you can still have a happy, productive life.
Perfect. Thank you so much for being on the show today. We appreciate it.
You're welcome. Thanks for having me.
Coming up next, we're going to talk about what happens if you are prescribed an opioid and how to avoid the risk. Stay with us. We'll be right back after these messages.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Life is made of stories. Stories that we all share. But some of us have a hard time reading due to a vision, reading, or physical disability. The Montana Talking Book Library is here to help. Call 1-800-332-3400 to learn if you qualify for this free service, because no story should go untold.
In one afternoon, Ryan and Kim Rademacher's lives changed in a heartbeat.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
Ryan came into the house with some pressure in his chest and aching in his arms. I thought it was probably his heart, and I knew we needed to call 911.
I couldn't believe this was happening, a heart attack at 45.
I was so scared he wasn't going to make it, but the ambulance was here right away.
Tests showed Ryan was having a STEMI, a type of heart attack often called the Widowmaker. Our EMT transport team activated the hospital's STEMI code to prepare them for Ryan's arrival.
I'm here, I'm healthy, and I have no heart damage. I didn't play Mr. Tough Guy. I dialed 911.
Every second matters in a heart attack. Call 911 at first signs. For more information, visit heart.org/Montana Lives. This message sponsored by Mission Lifeline Montana.
Welcome back to Healthy Living for Life. Joining us now is Tony King, a pharmacist, to talk to us about when we are prescribed opioids. And thanks so much for being with us this morning, Tony.
And I appreciate the opportunity.
So let's start out by talking about, when does someone know if he or she has been prescribed an opioid?
Well, hopefully when the provider prescribed the medication, they go over what the medication is, what it does, what you're to expect, and any side effects. So hopefully during that time, the provider will tell you that it's an opioid, or when the pharmacist dispenses it to you, that they offer the opportunity to consult with you and discuss it with you. If not, when the pharmacy dispenses it, they will give you information about the medication, and in that information, it will describe what the medication is, what it does, what to expect for side effects, and then you should have that opportunity to see if it is an opioid.
Okay. Can you talk about some of the rules or guidelines that are in place to make sure that opioids are being safely prescribed to folks?
Absolutely, and this is changing quite rapidly. In the last couple of years, there's been a big push to regulate more of what can and cannot be prescribed opiate-wise. Many of the pharmacies now have limitations on the amount of opioids you can get, the number of days supply, how often you can refill it. A lot of insurance companies have taken that route as well. Here in Montana, during the last legislative session, a bill was passed that if you are opioid naive, meaning that you have not had an opioid in the last 90 days, that the prescriber can only write for a 7-day supply. So if you are new to the medication, that you're not getting too much to take home. Other states have done differing things, and we're still looking at that to make sure that is the right route for Montanans. But it's changing depending on where you go. Many provider offices and hospitals also put limitations onto what their prescribers can write for.
Okay. When is the right time for a prescriber to give a patient an opioid prescription?
Well, hopefully all else has failed. Hopefully they've gone through all the other treatment options, physical therapy, surgery, what have you, just to make sure that this is the last step in the treatment.
Okay. And are opioids effective? When we heard from Dr. Kunzweiler about when they can be effective, but talking specifically about chronic pain, are opioids effective for treating chronic pain in your opinion?
Treating chronic pain, no. Unfortunately, there's generally not a cure for most chronic pain. It can help with the symptoms of chronic pain, but it won't cure you of it. They are effective in helping with the pain short term, but the longer you're on it, chances are you're not going to get as much relief from the opioids.
Is there ever a time when someone would be on an opioid long term?
It's very, very rare. So let's say cancer, hospice, palliative care, everything else has been tried and nothing is shown effective. And a lot of times now, those that have been on opioids a long time will still need opioids. It's tough to taper off. It's rare. It's more rare these days. We do still have some patients that require it daily.
If someone is prescribed an opioid, what do they need to know to make sure that they avoid any possible complications or risks?
Sure. The number one thing to remember with an opioid is the longer that you take it, the higher the risk of addiction is. This medication does affect the central nervous system, meaning it dulls the senses, it dulls what you perceive as pain. You're not going to act as fast, you're not going to be as sharp, and the more that you're on it, the more your body adjusts to having that, and your chances of addiction go higher.
Are there people who should absolutely avoid taking an opioid, either because of an underlying condition or other medications they're on?
Sure, and again, as we said earlier, hopefully this is just a last opportunity for treatment. Hopefully we've done everything else. There are rare occurrences where you're on some other medications, and this will boost the effectiveness of both. Sometimes you're on medications where you'll need a higher dose of opioids to get treatment, therefore increasing your risk of overdose. But generally, talk to your doctor, talk to your pharmacist, make sure this is the right route of treatment for you.
How long does it take for someone to become addicted to an opioid?
Well, and those studies are still ongoing, and numbers are changing fairly rapidly. We do hear of, depending on the person, sometimes as early as 2 or 3 days. Wow. Sometimes they say it could take up to a week, but some sort of dependence may start fairly rapidly.
Okay, so people at home really understand. Can you talk about what the dangers of opioids truly are? Why do we have to be so careful when it comes to opioids?
Well, and there's a lot of information going out, and providers and other groups are doing a great job trying to educate their patients. But opioid overdose is one of the leading causes of death in the United States. There generally are more people die of opioid overdose than car crashes. So patients that have been on opioids long term and then get treatment and then go back to opioids are at a higher risk for overdose. Adults generally no, but leaving it out for teens or even younger people that might not have had opioids before also increases the risk of overdose.
And there are people out there who think opioids, misuse, abuse, overdose, that's just something that's happening in a back alley somewhere. Can you speak to that a little bit too, as far as where these overdoses are happening?
Yeah, they're happening everywhere. I know that sometimes there is a perception that it's not going to happen to me, or it can't happen to my family, my friend, my neighbor. Unfortunately, there are overdoses happening everywhere throughout Montana and the United States. We see it a lot in injuries, sports injuries. Maybe you get hurt playing baseball, football, basketball, what have you, and the doctor prescribes you a couple days worth of opioids. And then that just snowballs into an addiction and possibly an overdose.
Okay, great, Tony. Thanks so much for all that great information. Appreciate your time.
Thank you.
And thank you so much for tuning in today. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.